Hello, it's Thursday, June 30th, 2022. It's Dr. Rhonda Johnson, and today I'm going to be discussing Paxlovid. Well, you may have heard that Dr. Anthony Fauci had a rebound in his COVID infection after completing his first course of Paxlovid after he was diagnosed with COVID on June 15th. He said he completed his 5-day course, felt better, tested negative for 3 days afterward, but on the 4th day he tested positive again, and he said in his second go-round with COVID he felt worse than the first. So he took a second course of Paxlovid and says that he's feeling better, although he's not completely without symptoms, and I certainly wish Dr. Fauci full recovery from his COVID infection. But what might be causing this rebound in Paxlovid? This is not new. Dr. Fauci is not the only one who's been experiencing Paxlovid rebound. Well, doctors aren't sure. A group of San Diego infectious disease experts studied a patient with Paxlovid rebound, and they did test on the viruses, and they determined that the variant that was infecting that patient had not developed drug resistance or immunity to Paxlovid, but felt that the 5-day course may not have been long enough for the tissues to fully eradicate COVID from all the tissues. However, I don't think we can jump to any conclusions from a study of one patient. So let's go back and review who might benefit from Paxlovid. It is currently under emergency use authorization in the United States to treat high-risk people who test positive for COVID and who are 12 and up, who weigh at least 88 pounds and are at high risk for progression of serious COVID disease. It can only be prescribed by a doctor, and remember that the prescribing physician needs to know about your medical history and your medications. Before beginning your course of Paxlovid, make sure your doctor and your pharmacist know if you have any allergies, if you have liver or kidney disease, if you're pregnant or planning to become pregnant, if you're breastfeeding, or if you have any serious illnesses such as HIV, seizures, high blood pressure, you're under treatment for atrial fibrillation or high cholesterol. Because Paxlovid can have serious and life-threatening drug interactions with certain medications. So again, it's important you tell your doctor and your pharmacist what prescribed medications you're on, and don't leave out the over-the-counter meds that you may be taking and all of your supplements. A lot of people take a lot of supplements. So either bring them with you and put your medications in a bag or write the names down. That's my message today. Paxlovid is a therapy for the right patients. You do have to watch out for this phenomenon, rebound. And again, it needs to be prescribed by a doctor, and your doctor needs to be familiar with your medical conditions. Thank you. And as always, be safe and take care.